Line unmuted. Conference recording started.
Good afternoon, and thanks so much for joining in. I want to start by giving an update on the emerging wildfires that broke out yesterday in several places across our state. Initial attack was significant, with 17 new fires burning over 100,000 acres due to what's really extreme fire weather conditions. Among those fires, we saw several significant fire events. The Huff fire was human-caused and started near Jordan yesterday. Fire burned over 30,000 acres in the first about 12 hours. The town of Jordan and unincorporated communities of Cohagen and Rock Springs were evacuated yesterday. Most residents have now returned to their homes. We're anticipating significant impacts to agriculture and ranching operations in that area. The Bobcat fire was also human-caused and started south of Roundup. The fire burned over 20,000 acres in the first burning period. Several rural subdivisions were impacted, and initial reports indicate that several primary residences or homes were lost. Signal Peak Energy's Bull Mountain mine was also evacuated. The Snyder and Rice fires started near Ashland and are currently under investigation. The fires burned around 38,000 acres in the first burning period. The town of Ashland was evacuated yesterday evening, but residents were allowed to return home this morning. Residents are advised, though, still to be prepared to evacuate if the weather conditions do change. Our Department of Natural Resources and Conservation secured approval from FEMA for federal management assistance grants to assist with the costs of fighting the Huff, the Bobcat, and the Snyder Rice fires. I am thankful to FEMA for their quick turnaround in approving these grants. Additionally, other fires, including the Birdseye fire here in Lewis and Clark County and the Ramspec fire in Marr County, started yesterday. Birdseye fire is already considered contained after a rapid response of state, county, volunteer, and National Guard firefighters and personnel. The Ramspec fire is also considered contained at this time. Unfortunately, 2 primary structures and several outbuildings were lost during the initial attack, and the area also has significant power line damage. If you're planning on open burning this month, please take precautions to prevent wildfire. All of us certainly need to stay mindful of current weather conditions and local fire restrictions. Please remember to keep the piles that you're burning small and never burn on hot, windy days. Never leave your fire unattended, and if your fire gets out of control, please call 911 immediately. As we manage these 2 concurrent situations, with wildfire season certainly upon us and COVID-19, we ask that Montanans continue to take those precautions to keep themselves and their families safe. Rural and urban communities in many areas of our state are being impacted by both. Remind us that no matter where we may live, a wildfire or the spread of the virus can present challenges that we have to confront and adapt to. When it comes to what we've seen with COVID-19 cases, after a sharp increase in cases that began in mid-June, we have 7 consecutive weeks now with approximately 800 cases added weekly. Many of our smaller counties and tribal partners have contributed a significant number of cases over the past month as they work to prevent further spread. Our larger counties continue to report the majority of cases, with nearly 1,000 cases in Yellowstone alone. In the past month, we've also seen increases in Cascade and Flathead, while others like Missoula and Gallatin have been relatively stable. As you know, we've been experiencing some real concerning outbreaks in some of our tribal communities. Crow and Bighorn County's outbreak began in late May, and since then over 650 cases have been reported. Now, the dedication of tribal health and their staff has been truly remarkable, and they've experienced fewer cases for each of the last 3 weeks, which is a trend that we certainly hope will continue. Rosebud County and the Northern Cheyenne Tribal Nation are addressing a more recent outbreak that began in early August and has grown at an alarming rate. To date, approximately 275 cases have been identified there in the last few weeks. In both of those areas, Crow and Northern Cheyenne, federal and state partners from Indian Health Services, the Center for Disease Control, and Montana's state and local disaster and emergency services have collaborated to provide support for contact tracing, on-site nurses, testing resources, and other needs. The outbreak has prompted tribal leadership to continue a stay-at-home order to slow the spread as quickly as possible. Montanans and visitors alike should respect the tribe's measure to mitigate the virus by adhering to the stay-at-home order and any other restrictions at this time. We already know all too well how fast this virus can spread and how it can be detrimental to populations, how it can burden healthcare providers in these rural areas of the state. And to their credit, we've also seen rural communities like Phillips County significantly reduce active cases after an outbreak. Early on in the pandemic, the Department of Public Health and Human Services had compiled an inventory of healthcare workers that could be deployed to other areas of the state if in need of that additional workforce. From that registry, where we reached out to healthcare providers in every corner of the state, we currently have 3 registered nurses deployed or working in Northern Cheyenne to provide assistance. From Townsend, Libby, and Bozeman, these nurses have really answered the call, and we're incredibly grateful for them devoting time to serve in Northern Cheyenne. We also have additional contact tracers on site from Circle and Bozeman, as well as additional EMTs. Congregate settings continue to present a challenge. The recent increase in Cascade County can be partly attributed to cases in the Cascade County Regional Detention Center. Detention centers in Yellowstone and the Bighorn and Crow areas have also had recent outbreaks. Fortunately, the state's testing capabilities, including turnaround times, have improved, and we're able to quickly assess these situations and work with locals to respond. Again, the case of the Cascade County Detention Center, the local public health department coordinated with Alluvian, which is the local community health center, and the state to test 500 people within 48 hours. Flathead's recent increase has impacted a long-term care center. Also serves, I think, as a reminder of the need to protect the state's most vulnerable settings. Over 40 residents and 12 staff have been identified at a single facility. This includes 6 deaths and 3 individuals currently in the hospital. The state's long-term care and assisted living facilities have been a primary focus of our prevention efforts since day one. Testing of all residents and staff was offered and completed during the months of May and June. Our efforts continue as we've gone actually beyond federal requirements for long-term care centers and filed an emergency order requiring that all assisted living facilities test staff as a condition of offering visitation. Even with these efforts, though, collectively in Montana, we have not been able to prevent all the outbreaks in these settings. To date, 47 of our approximately 280 facilities, or 1 in every 6, have reported a COVID case in a resident or staff member. These settings have experienced nearly 340 cases and 35 deaths since March of this year. We'll continue to aggressively protect our most vulnerable populations, supporting responsible testing, inspections, and on-site infection control evaluations in these settings. In addition to deploying on-the-ground resources to communities fighting the virus, we're also continuing to get coronavirus relief fund dollars out to individuals and businesses to support economic recovery. We've allocated nearly $1 billion in coronavirus relief funds, and with over $370 million of that into people's hands, including grants that have gone to nearly 12,000 Montana businesses and organizations. This includes support for everything from making sure that businesses can keep employees on the job, to helping our agricultural industry and other entrepreneurs adapt to challenges during this time, to keeping our live entertainment industry afloat, and helping businesses purchase supplies to keep them and their customers safe. There are new applications being reviewed for accuracy and compliance in accordance with federal guidelines daily, and additional funds are being awarded daily. Since announcing the loan deferment program in June, which defers payments on existing loans for 6 to 12 months, we've awarded $36 million to over 1,000 Montana businesses to defer $115 million in loan payments by those businesses. That means for every dollar that's awarded in the loan deferment program, Montana businesses are receiving $3 in direct benefit. This program is open to all businesses with a loan that meet the criteria, but is specifically targeted to meet needs identified in the hospitality industry. Pleased that many businesses in that industry, and particularly within lodging, have been able to utilize this program to free up capital for borrowers to leverage on a monthly basis. The state of Idaho recently reached out to our office about the program. It's working to replicate it for Idaho businesses as well. Now, these dollars have gone a long way to support Montana businesses and ensure long-term stability. Today, I'm pleased to announce that we're building off of that loan deferment program to offer support to businesses that may not already have a loan, but they need access to additional capital after a loss in revenue due to the pandemic. The Montana Working Capital Program will allow Montana businesses to take out a new loan to be used for payroll, employee benefits, lease or rent, inventory, utilities, and insurance. We'll utilize the unused portion of the $125 million allocated to the loan deferment program to fund this working capital program. New borrowers can work through an approved lender to take out a loan with then 35% of that loan granted through coronavirus relief funds. The borrower would still be responsible for making payments on the remaining 65% of the loan. Maximum loan size is $500,000, so with a maximum grant size of $175,000. Borrower would then be responsible for making payments on the remaining $325,000. To be eligible, borrowers must have experienced at least a 15% reduction in gross revenue attributed to the direct or indirect impacts of COVID-19. Then the rates and the terms will be determined by the lender and the borrower. Like the loan deferment program, the new working capital program will be run by the Board of Investments in partnership with Montana banks and credit unions. We'll begin accepting loan applications next Tuesday. And I want to, in addition to the efforts of the Board of Investments, really want to underscore that I appreciate the assistance and efforts of our banks and credit unions across the state in being a partner in getting this money out to businesses that need it. Come Friday, tomorrow, the Center for Disease Control is expected to put in place a nationwide moratorium on evictions through the end of this year. This will cover renters here in Montana, and it'll protect a renter from eviction if they've lost a job and are unable to pay rent. The renter still must use, and this is the federal regulations, best efforts to obtain all available government assistance for rent or housing, and it doesn't relieve that individual from an obligation to pay that rent. In May, I had allocated $50 million in coronavirus relief dollars for emergency housing assistance to make sure that Montanans were able to stay in their homes. I'd encourage any Montanan who's lost income because of COVID to learn more and apply to that program, which could cover up to about 75% of your rent or mortgage each month. This past Monday, we made upgrades to the Emergency Housing Assistance Program, making it so that more Montanans may be eligible for monthly rent and mortgage assistance. The eligibility updates include reducing the household contribution calculation from 30% of gross income to 25% of net income, eliminating the requirement that of 10,000 readily available asset limit in checking and savings accounts, and implementing a minimum $250 per month award. I've also allocated $180,000 to the Montana Legal Service Association through the fund to ensure more Montanans can access those free legal services. Services are available to those Montanans who can't afford a private attorney for eviction prevention, family law, domestic violence, survivors, public benefits assistance, and assistance with debt and bankruptcy management. Finally, as we approach Labor Day weekend, I want to remind Montanans to continue to take precautions to reduce transmission of the virus. Around 13 counties in our state right now have identified community spread. And a big source of community spread is social gatherings that aren't following the guidelines. It's on, at the end of the day, each of us to be a good neighbor and to take every effort to protect those around us, especially those who are most vulnerable to major complications and even death should they contract COVID-19. New normal certainly means we shouldn't have social gatherings without proper precautions, including masks at outdoor gatherings of over 50 people or where social distancing can't be maintained. It means if you have symptoms, you stay home and you call your doctor for a test instead of exposing your friends or coworkers to COVID-19. We know some previously healthy Montanans have struggled with the aftermath of COVID-19. Lung issues, heart problems, and debilitating fatigue have been documented in people who've recovered from this virus months ago. We have no idea when these folks' health will certainly return to how it was before coronavirus, and indeed that this virus may have permanently altered some people's lives. So a lot's riding on Montanans working together to keep COVID-19 at bay. By being careful, we make it safe to operate and shop at local businesses, so our progress toward economic recovery can continue. We make it safe so the students who rely on school for more than just academics can also be accessing nutritional meals or receiving mental health support. It's certainly critical that we do everything we can to keep our schools open for our kids who need that placeable safety and enrichment. We need to be cautious about following public health guidelines and the recommendations of experts like our state epidemiologists. No barbecue or party is more important than your health or the health of your family, or making sure that our kids can keep learning in the classroom. So enjoy all that Montana has, but please exercise that caution this weekend. I know we all want our old normal back, but especially this celebratory weekend, it's critical that we're cautious, knowing that COVID-19 is still very much a part of our lives here in Montana. I'll now open it up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you should be notified that you'll called on to ask a question. If your question's already been answered, you can press 5* again, and the hand will go down. Any questions? First phone question.
Hi, Governor Bullock. Thanks. Hi, Governor Bullock. This is Iris Samuels with the Associated Press. I have a couple questions about the coronavirus relief aid. So a couple of the programs you mentioned today, including the loan deferment program and the emergency housing assistance program, have been underutilized given the initial amount of funds you allocated for those programs. I'm hoping you can tell us how you determined the initial allocation for each of those relief programs and for this new program, and why they haven't been used to that extent so far.
Yes, so in setting what the initial allocations would be, we really did talk to both experts in the communities, speaking to businesses, speaking to industry leaders, trying to get a sense of how much money might be necessary, because also with the concern of if we're oversubscribed, we want to be able to have that pocket. So as you point out with the loan deferment program, we haven't hit that target by any means. And that's one of the reasons why, as we roll out the working capital program, we keep it within that same $125 million bucket. Speaking to both banks, landlords, and sort of the community help organizations, thought we'd get a lot more of the demand on both the renter and mortgage assistance program than we have. So as we make changes to that, and then also recognizing as the federal government has put an eviction essentially ban on evictions for the rest of the year, we want to see what additional dollars might be subscribed through that program. Now, look, at the end of the day, and not just the end of the day, but as we look at demand for programs, I'll note that there are others. There was a meat processing grant program that we allocated a specific amount of dollars, and good qualified applicants came in that far exceeded that. So we're looking at shifting some dollars from one program to another to cover those applications. We'll continue to use our best estimates, and that's everybody from the budget office, which has been more or less coordinating a lot of these programs, and my Office of Economic Development, working with stakeholders what the demand might be, and if demand is either less or greater, then doing our best to make those adjustments. Next phone question.
Hi, this is Kayla DeRoche with Yellowstone Public Radio News. Montana's coronavirus testing positivity rate has been above 5% for much of August, and positivity rates above 5% means more testing should probably be done, and suggests it's not a good time to relax health restrictions, according to Johns Hopkins. Based on the testing that is happening in Montana, do you feel you have a good handle on where the virus is, and if not, what's your plan for increasing testing?
Well, I think so. Certainly, would like to get, especially in those 13 counties and communities that have community spread, have even identified that, more saturation testing to get that much better sense of what the virus might be doing. I mean, I look at over the last 4 weeks, the total was performing 73,856 tests, in a lot better position than we were before I'd even put the target of 60,000 over the next month. We'll continue to work with both local health and stakeholders on the ground and our epidemiologists to make sure that testing is sufficient. And when I say testing is sufficient, well, it is that partnership working with local communities and trying to provide additional assistance when it's necessary. But both from a turnaround time perspective and a capacity perspective, I'm confident that we have what we need in Montana to meet those needs. Next phone question.
Hi, this is Phil from Great Falls Tribune, and I noticed that Cascade County had a very high rate of cases today, 58, and was wondering if there's anybody there that could provide any kind of perspective as to what's going on in Cascade County, if it is related to the detention center.
Phil, yes we can, and I'll have Jim Murphy, the head of the Infectious Disease Bureau, talk a little bit about Cascade County.
Thank you.
I think what Cascade County is experiencing is what a few of our other communities have experienced, which is the challenge of dealing with cases in a congregate setting. Cascade County's recent increase is attributed almost solely to the Cascade County Regional Detention Center. Fortunately, the County Health Department and one of their partners, the Community Health Center Alluvian, got involved really quickly, did a great assessment. In a matter of one evening, they tested about 500 people. We had results out 2 days later. And I think that says something for the testing capacity at the State Public Health Laboratory, getting them results back quickly. That initial assessment allowed them to separate ill from the well people as quickly as possible. Unfortunately, given those congregate settings, it's a real challenge to get these things under control. They're continuing to address that. They're doing a lot of testing in that facility right now, and we're hoping that they're turning the corner on that. But very challenging. We've had other detention centers with challenges as well. I think the size of the Cascade County Detention Center possesses some unique challenges, but I think they're doing about as good as anybody could do in that kind of situation, and we'll continue to support their efforts.
When you talk about unique challenges, sir, are you meaning getting the inmates to wear masks and things like that, or ventilation, or I didn't challenges are in a facility such as that?
Sure. I think by their very nature, like any congregate setting where you're putting a lot of people in one place, they can't freely go, you're going to run into these challenges. It comes down to numbers and space. Mask use also has its challenges in these facilities because masks can be misused. So there's a lot of unique things that happen in a detention center that don't happen in a nursing home or don't happen in an assisted living facility. We can't just let everybody go from the detention facilities either to respond to the event. Staffing is also challenging. Staff wear personal protective equipment as well. And there's limitations on some of the things that they can wear. But one of the priorities is to protect the staff that are involved in this, as well as protecting all the residents. I think it comes down to mostly the close quarters that are involved. and limited options with trying to separate people. That makes all of these kinds of settings especially challenging.
Thank you.
Next question.
Governor, this is Taylor Brown with Northern News Network. I appreciate your comments about the wildfire situation and wanted to ask a little bit more about the FEMA designation, realizing that it seems like it's always a couple of days till we really understand what the need even is, but I'm impressed with the fast action of FEMA. If they've already made that announcement this morning, that's tremendous. What can you tell us, though, I guess, about what that might entail, what that FEMA disaster designation this morning might entail to help these 17 new fires you mentioned?
And Taylor Brown, it's great to hear your voice on this. You're actually doing the real work of Northern Broadcasting again. So,
oh yeah, stuff, you know. So you got to go back to work someday, but not all of us, maybe.
Yes. So really, what the FMAG designation is looking at how the fire will be paid for going forward. And it is one where, like, I remember the fire in Jordan a few years ago in that area where it took us weeks to get that designation. And I mean, remember explaining to the head of FEMA that the size of that was like 7 districts of Columbia altogether. So what it essentially does, though, is mostly looks at just how the funding stream will go in paying for this. I'm confident that Montana has, a fire fund. We're in a good position, but it's also then the recognition at the federal level that it's a disaster of the scale that if we don't get our hands around it, it's more or less on sort of everybody's vision points of saying that this may be something that needs additional resources in other areas. It is, and I did note, I guess I'd say, Taylor, in the comments, though, that, and look, we've been working with our regional administrator, Lee DiPaolo, with FEMA since early on in this COVID-19 public health emergency. And to have then both our DES and them sort of double tracking along the way, not only dealing with the public health emergency, but fires, I do really appreciate their prompt action. It was a couple years ago that we couldn't always get FEMA and the state on the same page. At times, FEMA will even bring up their representatives and have them sit with us side by side in our fire management teams.
Governor, I might just mention, too, since that fire you mentioned 3 years ago, we've had a lot more equipment deployed out there by the DNRC and others, providing firefighting units at individual ranches, for example. I bet your team could find out pretty quickly, but on those 17 fires, I'll bet an awful lot of that equipment was used on these fires. I know in our county we had like 20-some of those units in Garfield County, and a lot of them were on that fire yesterday. So that action of placing that equipment out there so local people can react quickly, I think is going to make a huge difference this time.
No, and it is great that over the last couple legislative sessions, actually, we've built additional DNRC, more or less the fire trucks that can stay out there. As you know, Taylor, and all folks do living in rural areas, the other, I guess, inspiring thing to see with the Huff fire is it does become all hands on deck. I mean, that ranchers and neighbors, in addition to the DNRC engines, are all working together and working dang hard to protect both property and lives. Next phone question.
Hi, Governor Bullock. It's Maritza Giorgio with NBC Montana, and I have 2 questions. My first is that Flathead County switched to an all-mail-in election this morning, meaning 43 of our counties are now going in that direction. From your office, what's next on this new lawsuit challenging this 2 months before Election Day?
Well, I think, Maritza, also the deadline to designate whether a local county elected election administrator and the clerk and recorders want to designate all mail-in or otherwise closes Friday. So we'll get the final numbers, but I think, as you noted, 43 of 56 counties so far have exercised the local control and power and doing it exactly the same way that they did in June. I mean, we left the decisions about that election in the hands of local authorities. You bring up this lawsuit now, essentially we have Washington outsiders trying to come in and take away that local control and interfere in our elections. And I think that most folks in Montana recognize just how absurd that really is. When we look at the fact is it was bipartisan coalition of Montana election officials, vast majority of whom are Republicans, actually asked for this change to reduce the risk of COVID-19, protect election judges, Montanans alike. The directive that was sued under on yesterday by the National Republican Party and the Trump campaign, it's the same directive that we used in June, which was a directive that both the Republican President of the Senate and Speaker of the House back then said was the right thing to do in the June primary. Today we actually have many more active COVID-19 cases than we did back then. Back when I issued the directive for the June primary to let the locals decide, we had 0 positive cases, or 0 deaths. Now we're up to about 109 or 110. And we also had the opportunity in June to see that voting is safe and secure, and it actually, I'll be darned if it didn't increase turnout, including among Republican voters. So we'll answer the lawsuit. I mean, filing when they did, how they did, I think it's more about being a political stunt than it is about actually impacting, I hope that's the case, impacting local election administrators to have local control about what would be best for people in their county.
All right, thank you, Governor. And my next question is, if there's a concern about resources in some of these communities seeing spikes in numbers, I mean, Yellowstone County today said they're struggling to get in touch with all their cases and contacts from August. And on a personal note, it took my grandma nearly 5 days to get results from a test they gave her when she was admitted into a hospital last week.
So Maritza, one more I'm not quite sure I understood that. Is there concern that local counties have enough? And the personal note was your grandmother got admitted into a hospital and it took 5 days for the result?
Yeah, I'm wondering if there's a concern about resources. I mean, Yellowstone County talked about struggling to reach all their cases and their close contacts from August, and then, people being hospitalized in some of these communities with spike in cases, taking that many days to get COVID results back when they're hospitalized.
Yeah, so there are two different kind of questions involved in that. One of which, and I don't know the specific, with the healthcare provider and what might have happened. What we're seeing by and large right now is that from the time a test is actually submitted to the state lab, it is at most about 48-hour turnaround. And so I don't know if that healthcare provider was sending it out to a reference lab outside of the state system. Any number of things might have happened. And we continue to keep in contact with local health, public health, to try to say what resources do you need to make sure that you have sufficient contact tracers and other personnel. That's in the specifically examples of actually getting those registered nurses to go to Rosebud County, or earlier working with Yellowstone County and getting students, kids that had just finished their degree as contact tracers. So we continue to have those conversations with our local public health officials. When additional assistance is needed, we try to figure out ways to fill those gaps. Last phone question.
Yeah, hi, it's Gwen. Hi, it's Gwen Florio with the Missoulian. I am just wondering, with fall coming on and a concern that people need to get their flu shots, if we know whether Montana is going to have an adequate supply of those.
Let me turn that over to Jim Murphy.
As far as the vaccine availability for influenza vaccine, right now, I think it's important to remember that the orders that most of the county health departments and most of the medical providers place for flu vaccine actually get placed back in months like February and March. So a lot of those orders were in well before COVID, hit us with especially this level of impact. One of the things that the Center for Disease Control has done is they provide additional resources to the state health department, and we're working with our local partners to make sure that they have the systems in place to deliver influenza vaccine this fall. The Center for Disease Control has allocated additional doses of adult vaccine to the state of Montana to try to meet what we anticipate will be a little bit higher demand because of some of the concerns around getting influenza and then maybe having a risk of getting COVID on top of that. So the state and local health departments are gearing up for this. I think the biggest challenge we're going to see is local health departments that are already stressed because of COVID response also being able to respond to the needs for vaccination for influenza. Because of that, we're working with some partnerships. We know that the pharmacies in Montana are going to step up in a big way and deliver influenza vaccine, and that's really going to help us meet the demand out there. We also know that we're looking with our community health center partners to address some of the needs in their communities and try to deliver vaccine more efficiently. So I think what we'll see is there's going to be a tremendous effort to make sure that everybody that wants to get influenza vaccine this fall can get it. Supply is maybe not the issue as much as the delivery systems responding to some of the other demands on them. We're optimistic that everybody's going to be able to step up and respond as needed. It's really important to us to try to make sure that as many people get influenza vaccine as possible, because if we can keep people from suffering influenza and we can keep people with influenza out of the medical system, that's going to free up resources that we might need to respond to COVID. So we do have that on the radar and are trying to respond with our partners the best way we can.
Thank you.
Yeah, and as the governor points out, this has been one of the things on the radar for the last few months. Working with our partners in disaster emergency services, we've had people from the health department kind of going over, what some of the larger plans are for large-scale vaccination efforts, not only for influenza, but for what we anticipate will be COVID vaccine that will be coming on down the line. So I think this is an important thing on everybody's radar right now, and we're pretty much getting ready for it. There's already places out there that have started to offer vaccine, and we do encourage Montanans to take advantage of the vaccine whenever they can. Get it as early as you can. It's already being offered in many pharmacies, and it's not too early to start those efforts.
Gwen, it was, and that was me just also, underscoring that as we look at, so a team in part through disaster emergency services has led so many of our efforts and sort of brought the right people around the table when it comes from, procuring supplies to anything else. And this has been a topic that we've already been working on for, dang near probably 6 weeks. But to underscore what Jim Murphy said too, is that make sure to get a vaccination for flu. Both because of the needs on our healthcare system and the challenges with COVID, it'll only make yourselves and your community safer if people get vaccinated as soon as they can.
Governor John Riley, Montana Television Network. To follow back up with Iris's question earlier, it sounds about a third of the $1 billion that's been allocated has been given to Montana hands. However, in covering these programs, the big issue that I've heard is that a lot of Montanans qualify but haven't been applying. Is the state looking at ways to address that?
Well, a couple different things. Like if Montanans qualify and haven't been applied, that is but yet one example, is one of the reasons why during a press avail like this, I talk about renter assistance and homeowner eviction assistance. And I do encourage all Montana businesses, and in many respects individuals, to go onto the website and see what may well be available there to provide some assistance. It is no exaggeration to say that, as an example, I was talking to a restaurant owner in Missoula yesterday, and she was saying, here's what we've lost, here's what we've been able to get, is there anything more that we can do through new programs? Well, I connected her with a staff member, and then she recognized, no, it's not necessarily even about new programs out there. There are things that might be able to help a business right now. So highly encourage folks to take a look at that, and we'll continue as we did with the working capital program. You know, we started this loan deferment program in part from hearing from hotels and the hospitality industry to say, this may be exactly what fills and meets the needs that we have. But then recognizing that not everybody is banked as well with loans. That's what got us this next program as well along the way. So I would encourage people to certainly look at the various programs available. I guess I'll just close with two things. For so many of our Montanans, younger Montanans, the excitement and the anticipation certainly was felt in households just like it was in our household this morning, as our two kids at home still went back to middle school and high school. So there's a lot to be excited about after probably, in many of our communities, 6 months of our kids not actually seeing their teachers or being in the buildings. I hope that all families and parents will continue to recognize what we need to keep people safe. Also, I guess, have the patience and kindness as our schools get back going in, recognizing that they are going to be looking a little bit different than they have in the past. And then I'd also, again, just underscore that let's all enjoy a long weekend, Labor Day weekend, celebrate sort of the hard work ethic of Montanans and what we've been able to do, get together with others, but do it in a way that we can walk out knowing that these numbers that we're starting to get our hands around in most of the areas of the state aren't going to increase. We did see significant increases after the 4th of July. So let's enjoy one another and the outdoors without letting our guard down. Thanks so much.